Hello and welcome to the Doc Podcast. I'm your host, Dr. Mike DeLuke, and it's my mission to help you lead a happier, healthier, and more prosperous life, both personally and professionally. Hello, everyone, and thank you for joining me for this episode of the Doc Podcast. Today, I'm thrilled to be joined by an amazing colleague, Dr. Courtney Lavigne. Many of you may know Courtney or have heard her speak, but just to tell you a bit more about her, after graduating from dental school at UConn, Courtney went on to practice restorative dentistry for 10 years. And during that time, she became accredited through the American Academy of Cosmetic Dentistry, gained fellowship in both the Academy of General Dentistry and the Pierre Fauchard Academy, and lectured nationally on dental aesthetics and comprehensive care. She also served as visiting faculty for Spear Education. Courtney then sold her successful restorative practice and decided to return to school and completed her orthodontic residency at Tufts University. She now owns and operates a successful practice in Wakefield, Rhode Island, and she lectures for the Seattle Study Club as well as the ASAP pathway. Courtney's significant experience as a restorative dentist not only provides her with a unique perspective on interdisciplinary patient care, but enhances her ability to communicate the orthodontic treatment objectives to her restorative colleagues and her patients. I'm really looking forward to speaking with Courtney today, as the personal and professional journey she's been on is nothing shy of amazing. And I really believe that her experiences as a parent, as a professional, and as a business owner will resonate with so many of our listeners. And that's really the case whether you're in the dental profession or not. There's going to be some consistent themes that we talk about that are just sort of the things we're all facing in life and the challenges we all face, especially those of us who own and run a business. So with that, I would like to extend a sincere welcome to Dr. Courtney Lavigne. Welcome, Courtney.
Thanks so much for having me. I appreciate it.
I appreciate you coming on, and having you on the show has been something I've wanted to have you on for a while. I love people that have an interesting path. I kind of had the traditional pathway. I went to college, dental school, went right on to my ortho residency. I did moonlight for a few years doing general dentistry in my family's general dental practice during my residency, but certainly didn't immerse myself in it for a decade as you did. And I think it's so interesting to hear the perspective of practitioners who have practiced in one capacity and then go into another capacity. And we'll talk today about what motivated you to do that and how that really gives you an advantage. And you just see things differently. Like we know what we see, and our reality is what we've been exposed to. And you've been exposed to a lot more than most of us. So tell me a little bit more about that journey and how it all happened.
Oh, which avenue should I start? So practicing as a restorative dentist, I say I did 30 years of dentistry in 10 years because I was doing mostly full mouth rehabs, large cosmetic cases, really high stress procedures, really sensitive, high cost of, expectations are high. And I learned a lot of that both through the Academy of Cosmetic Dentistry and through Spear Education. And what I found over those 10 years, especially as I started doing these more complex cases, is that most of my patients needed ortho prior to starting the restorative component. And I was learning from Frank Spear, Greg Kinzer, Gary DeWood, and they were showing cases that Vince Kokich Sr. was doing the orthodontic work. And I was seeing a lot of what was possible with orthodontics. And I would put together a keynote, send them to my local referrals, and I wasn't getting the same treatment options being told that they were available. So I felt like orthodontics was becoming a weak link in my practice.
Interesting.
And for me, I grappled a lot with it. Almost felt like we were speaking foreign languages. I would try to tell them what I wanted and they would say it was possible. And I didn't really understand why something was or wasn't possible. I grappled with, is what I'm asking of you not possible in your hands, or is it not possible in the orthodontic world? And I've since recognized that I think general dentists are led to believe that orthodontists are orthodontists, period. And that's not the case. Some orthodontists love treating phase 1 and early intervention, and some don't see kids till they're 12. And some, half of their practice is adult care and half of their practice is pediatric. And then other practices don't treat adults that much unless it's very simple, straightforward aligner cases. So I think at the time I had the expectations that all orthodontists should be able to do what I was learning at these restorative courses. I'd come home, ask for that, and it just wasn't what I was getting. Now, on the flip side of things, going through orthodontic residency, I'll see in a lot of the orthodontic forums, they're like, hey, my referring dentist is asking for X, Y, and Z. Like, this is my realm. Why are they starting to get involved here? And so there's still a large disconnect between the two areas. But that was on the one end. I felt like the practice that I had, more of a boutique, high-end practice with complex dentistry, I was frustrated with the orthodontics of it, and I wanted to understand more. And on the back end of things, I was struggling with my own airway issues that I ended up, part of my treatment journey had to do with orthodontic care as an adult. And once you kind of open that can of worms and see what's possible orthodontically to prevent the more invasive procedures I had as an adult, I started to become I didn't treat kids in my practice, but I had a lot of parents that would bring their kids in and ask for second opinions or just wanted to take a peek at something. And my treatment philosophy around early intervention, I started just to get curious enough that the combination of those two, as much as they're very different issues with the orthodontic world, I really needed to answer for myself. Is it me asking things that are not realistic or not research supported or not fair to be asking? Or is it that I'm working with colleagues that we're just not on the same page and our training is from different backgrounds? So I ended up selling my practice. Ironically, it was great timing. Everyone thought it was crazy for what I was doing at the time, but I sold my practice January 6th of 2020 to a prosthodontist and started residency that year.
Wow. What? And you were already married, family at that point? I mean,
yeah. So my husband and I started dating we went to high school together, started dating right after high school. When I went back to residency, we'd been together. I want to say we'd been married 10 years, maybe together 18 years, maybe.
Okay.
And then I have an almost 3-year-old daughter who we had during my residency program. Oh my goodness. So yeah, it's been a journey. The last few years have been tumultuous in terms of,
and
we're not in a steady state yet.
Definitely want to come back. And you are pregnant now. Well, what, 8 months you're at now?
I'm 38 weeks as of right now. So I'm pretty far along on number 2, and this is the grand finale with the family planning. So.
I want to come back in a little bit more on that side of things, just how you do it and how you manage it as a mom, a wife, a business owner, a clinician, practicing, learning, and you're out there teaching. And so I want to come back to that a little bit as well, but just staying with what you went through at that time. So, I mean, that's a major change. You are 10 years in. It's not like you got out a couple years, like this isn't for me. I mean, 10 years of private practice and restorative dentistry. And then to have this change, obviously there has to be a motivational factor there. And it sounds like something personal was at the heart of this. You had the experiences you were having as you described with the other practitioners, but tell me a little bit more about that personal side, the airway side of what you were going through, if you would.
Yeah. It's a little bit of a convoluted path, but what really started impacting my life in a negative way was during dental school. I was eating like 4,000 calories a day and losing weight and going through like colonoscopies, endoscopies, trying to figure out if I had a parasite. I would carry 4 peanut butter and jelly sandwiches around with me just because I'd get so hungry I'd have to like eat throughout the day. And then shortly after dental school, I got married and I was waking up at 2:30 in the morning every morning, huge adrenaline rush, sweating so profusely at that point. When I'd wake up, I had to change the sheets every day. And then I'd finally be ready to fall back asleep around like 6 a.m. And then it's time to get up and go to work. So I was just living a really exhausted life. And I happened to be at the Spear Summit that year. Jeff Rouse, who's a prosthodontist from Texas, was speaking. And he was talking about the young, fit female and what upper airway resistance syndrome is. And I just started wailing on the shoulder of my friend that was sitting next to me. I was like, this is me. Like, I've been going through all these medical tests. They can't figure out what's wrong. Had a sleep study done and realized that I had a lot of sleep issues going on. And
so none of those initial medical tests involved any sleep evaluation?
No, hadn't even crossed my mind.
Okay.
I'd been going just the traditional, Western medicine, like let's just test until we find what needs the pill kind of a mentality. And then the sleep study said, well, your sleep is garbage. You're not sleeping well at all. And I was basically running a marathon in my sleep with my tongue falling to the back of my throat, thinking I was suffocating, cortisol spikes, which led to the sweating, and my progesterone levels were all over the place. I was on a high progesterone birth control pill that I had just gone off of. Progesterone turns out to be sleep protective. So when I went off of progesterone is when the sweating started, because I had a sleep disorder underlying, and it just was tipped the scale enough when I took away the progesterone that was added to my daily routine.
Got it.
So all of that, I realized I had a problem, started seeking out solutions. When you look back at my history, I had a posterior tongue tie. I have, as an adult, a posterior tongue tie. So that was always there. Siblings wouldn't sleep in the same room with me at 4 years old because I was snoring so loud. Mom had to use a shield, trouble latching for a year. Like all of the things, as you start to uncover the area world I had, I just didn't know that they were an issue. But I had 4 premolars extracted when I was in 5th grade, and a few reasons premolars are extracted. We know you're either too crowded to fit all the teeth and the amount of bone you have available, or it can camouflage an underlying skeletal issue. So class 2 skeletally with a retrognathic mandible, when you look back at where I started from, took out 4 premolars, pulled back the upper, and just insufficient intraoral volume for what my soft tissue needs were with my tongue and airway. So as an adult, I ended up going through high histamine production from gluten and dairy. So I had to go with a naturopath to figure out the diet factor and get myself able to nasal breathe. That in combination with septoplasty and turbinate reduction to get a patent nasal airway so I could breathe through my nose. And then I went through skeletal expansion as an adult with an MSE in 2018. And all of the combination of that going, like, it was a long journey. It was a lot of appointments. It was a lot of, is this the right decision? And I'm such a different person energy level now. I've always been a high achiever. I've always run at a maximum speed, but that was running without being able to sleep well. And now that I can actually, aside from an almost 3-year-old and being 38 weeks, we have some new factors in there. But, seeing how
different etiology right now, but
absolutely. But all of those procedures were so life altering for me. I remember the first time I took a breath through my nose and I was like, that's what it's supposed to feel like.
Wow.
It just, all of a sudden, 2 things happened. One, the before and after of cosmetic dentistry lost its luster for me. It wasn't so fulfilling to be able to give them the mirror and see that like wow factor. But the other side of it, my periodontist used to joke that I specialized in 45 to 65-year-old females that wanted pretty teeth. And you start looking at all the women coming in with, why do they need the veneers? Why are the teeth breaking down? What are the occlusal discrepancies? And you realize so many of those patients had airway components contributing to the breakdown of the dentition like I did, and you can't unsee it. So I have a patient driving 3 hours to see me for veneers because they've seen my before and after photos. And then I'm saying, I really want to get a sleep study on you before we start doing this, because the predictability of and the longevity of my treatment is based on knowing why the teeth broke down to begin with. And I just had such a different philosophy and approach to my treatment that it got to the point where I knew I needed to answer questions that I felt like I couldn't answer without going back to orthodontic residency. And so it was enough to push the scale and make an interruptive financial and life decision to sell my practice and go back to school.
Wow. I give you tremendous credit. Number one, for going through all that and accepting it. I think a lot of people, you just end up in denial, and it's just like, I'll muddle through, I'll deal with it. These are that's the hand I'm dealt. But to take that challenge, especially at that time in your life when you're established and you're building this practice and putting so much into it and building a family, it really, that's it. Looking back, kind of, and as you go through it, I try to put myself in what would I have done, or where would I don't know. That's a lot you went through, and it's so awesome that you came out on this side of it and now are using that to help other people. And that's really, I think, what's the most admirable of it is that you didn't just say, okay, this was me, but you realize, wait a minute, there's more going on here. And there are a lot of me's out there that are suffering like this. And maybe I can change it for them. And I'm guessing you are. Have you seen sort of instances where it's someone who reminds you of yourself prior to all of this?
Now that I'm in orthodontics, it's every day, because I luckily have referral networks that I'm seeing the kids earlier. So I'm seeing 6 and 7-year-olds, and I can see the trajectory that they're on. The parents have now the foundation's been laid that we can make a decision. And I don't make the decision for the parents. I just inform them, like, we can intervene, and here's what we're trying to accomplish, and here's what the long-term might look like for your son or daughter. Or we can wait, and this is how traditional orthodontics in the past has been looking at this. And if we wait, here's what we might run into. And I really do try to make sure. I call myself a recovering airway dentist, because I think when you go through as much as I did, a lot of well-intended practitioners hold the weight on their shoulders that it's their responsibility to solve everybody's issue, and it's not. So many of the times I see a patient and I'm like, I'm not your first stop. You need to go to the ENT first. Here's what I'd recommend, and here's why. I work with sleep physicians to figure out what's going on with kids, that they come to me because they know something's wrong and there's some component that got them referred to my office. But I've learned that I am not responsible for everybody's problems, but I have a skill set where, when it's appropriate, I do feel like I can have a contribution towards their health and well-being, that without crossing paths with me and maybe a different practitioner, they wouldn't get to that same result. So it's really rewarding. I do feel like it's been a journey to go from learning all the information, wanting everyone to care as much as I do, and then learning to back off and say, I need to give what I have to give to those that are ready for it and that see a value in it, not everyone. And I think that's been the personal journey that has led to more professional success in this area.
Yeah, that's really well said, because sometimes it's the old, if you're a hammer, everything looks like a nail. Sometimes when we see something, or it's in the forefront of our minds, everything looks like that. And I think a lot of practitioners do fall into that trap and go down that path, because it's just so easy. If that's what you're hyper focused on, that gets your attention, and then everything looks like this could be an airway problem. And like you said, it's not, and it's not always something we can do anything about. But knowing and understanding the diagnostic and etiological side of things, so that we can determine when it is something we can do something about, and what we could do. And then if it's not, where we start and how to help that patient, is something I find is not being taught to today's orthodontic residents in mass. I mean, again, there's always gonna be outlier programs, and I know a lot of what's going on with Audrey and Stanford's amazing, and there's some programs, I believe Loma Linda's got much more progressive and aggressive approach on interceptive treatment, but still the vast majority of orthodontic residencies out there are, as you said, you said it very well, it's not the way we're traditionally taught, or orthodontics is traditionally done. Why do you think that is? Hey everybody, be sure to check out the Doc website, where you can get access to tons of great information, including free educational content, access to private one-on-one coaching with me, ADA CERP recognized CE courses, and amazing patient testimonials. Just go to theorthocoach.com. That's theorthocoach.com. And now back to today's episode.
I honestly think that it's an academic issue that extends beyond orthodontics. I think that Western culture looks a lot at how to put out fires. We don't look at how to prevent decay. We look at what the treatment plan is when the decay is present. We jump to, does it need a root canal, or can I do this with just a filling? Is enough of the tooth missing that it needs a crown, or can we do this with composite? And in orthodontics, it's more of like, okay, we have a posterior crossbite, the upper arch is too narrow. What are the tools we can use to make it bigger? We don't ask ourselves, why does this 8-year-old have so much decay that we're having to ask about crowns versus fillings? We look at what our toolbox has to fix it. And the same in orthodontics. We don't ask, okay, they're in a posterior crossbite. Why are they in a posterior crossbite? That's not a normal way to develop. Why is the palate arched and vaulted like that? And when you start to ask the why and look at the etiology, I think it's a mind shift change of how you approach your care. And to be very transparent, it is much less stressful, easier, and more profitable at the beginning to avoid asking why and just using your tools. And so I think it takes a certain person to say, I'm not going to make more money off of this. I'm not going to have an easier time treating because I care about this. But I understand it's really for the better treatment of the patient that I'm going to start delving into asking these questions and treating more comprehensively. And that takes a lot. It's asking a lot of the practitioner. A lot of my most frustrating cases are, MRIs for joints. They take down it's not a profit center for my practice, but it gives me tools where I can make better decisions for my patients.
Mm-hmm.
It's not fun to have to send a patient for a sleep study and for tonsils and adenoid removal when they're in a posterior crossbite first before I'm saying, okay, now let's expand. It's much easier just to say, hey, let's just expand. I'm an orthodontist. It's in my toolbox. I'm not going to make these other referrals for you and delay treatment for a year and a half while you figure out the other stuff. So it's asking a lot of the practitioner, but I think it comes down to finding the practitioners that really are patient-centric. And I think that's also the part that kills me, that there's this like bad assumption in orthodontics that if you do a lot of phase one, it's to make money. And I'm like, oh my God.
What is that?
Absolutely not. It's so much easier for me to do
one comprehensive
case in the future.
I almost think it's a deflection, because it's the opposite. Because if you once you get good and you can figure out phase one, and I developed an approach where I do it with braces and wires young, and I'm able, if it has to be young to do it that way, but you can get to where it can become profitable, and you can. But early on, when I was like just putting upper and lower expanders in these kids, and I mean, you can't charge enough. You take a bath on it financially. Mm-hmm. It's hard to do. It clogs up your clinical schedule. You're dealing with a lot more emergencies. Again, it's where I really worked hard to try to develop systems to do it more efficiently, because I didn't find phase one made it more profitable. I mean, yes, there's another charge there that you're charging, but your time, your overhead, and all the other part of that equation of profitability was going up as much or more. That I was doing it because I was passionate about, like you said, finding a solution that was treating the etiology, as opposed to just solving it the way we had been taught, which again, it's much easier when they're 7 and narrow and crowded to just say, well, let's go send you to your primary care dentist or the oral surgeon to start getting some teeth pulled. And we'll deal with this when you're a teenager. And I'm comfortable treating you because that's what I've always been taught to do. And I know how to treat a 12, 13-year-old kid. It's much more uncomfortable because, and I've talked about this a lot on this show, and I tell the residents when I teach them, it's clear to them. Most residents aren't treating 7, 8-year-old kids. And I know that might sound interesting to, so I have a lot of parents and people who aren't in the profession that listen to the show. And a lot of times I've gotten feedback from them like, I've never knew that you guys didn't learn how to treat young kids. Yet the AAO says age 7, which we can again have that debate. And Rebecca Bacow and I had a nice conversation about why that even is, because there's really nothing we know of that why 7 was this magical number from a data perspective, right, more than just a convenience perspective. But even that, like most orthodontists are coming out of their residency rarely, if ever, treating a 7-year-old. So you said it so well, in that it's asking someone to step outside of their comfort zone and take this step into a place that doesn't feel very familiar, involves a totally different philosophy, treating totally different age range patients with totally different needs. And then on top of that, being able to kind of suspend the reality of what you were taught all those years. And I almost feel like that's why they're like, well, it's just to make, it's almost like something they say, like just to say it because they know it's hard to defend. I don't know. I feel like that I've never found somebody who was so like, hey, if you do phase one, it's the only way to increase revenue for your practice. Now, I will say, I find it's interesting. I think if the orthodontists don't wake up on this, and we don't start to understand that we need to start treating these patients younger and earlier and more proactively, I think it will cripple our practices in the end. Because what's going to happen is the pediatric dentists and the general dentists, who by and large, and I've said this very openly, and I don't say this as in a way to disparage my orthodontic colleagues, they get it more than the orthodontist by and large as a profession. And they're going to start seeing these patients younger and younger. It's already happening. And those patients are going to now trust and believe in that doctor. And you know what? They should. If we told them we can't do anything about it and they help their kid, we didn't earn that. And I think we're going to have a day of reckoning in our profession in the next decade if we don't wake up and start to see that we need to have a bit of a paradigm shift here. I don't know what your thoughts are on that.
No, I agree 100%. I think a lot of the other specialty, before aligners came around, orthodontists owned orthodontics. Nobody knew how to move teeth. And so you just referred out and didn't know what happened on the other end of it.
Yep.
Dental school doesn't expose you to it.
Nope. You have to bend a quad helix maybe, or make a Holly in your little pre-clinic ortho lab, which exactly. I swear they had people bend the quad helices to see like that. Oh, they think I don't want to do this for a living. Like it almost dissuades a lot of people to, it almost did me. I was like, this is ortho, but anyway, sorry.
Yeah. No, I never thought about orthodontics during dental school because I thought it seemed really boring.
Right. Yeah,
Didn't get to do much that was exciting.
exactly.
But if you look at endo, if you look at surgery, if you look at perio, all of those specialties have become hyper specialized.
Mm-hmm.
And the low hanging fruit are kept within the general dentist office now. And there are some, these super general dentists that keep everything in house and aren't referring a whole lot out anymore. And when I talk to general dentists that are implementing early intervention orthodontics in their practice, it is not, most of the time, it is not because they're looking for a new profit center.
Agreed.
It's because they've had their own kids go through it, or they've gone through it themselves, or they recognize something that when they refer their patients out to the orthodontist, they're not getting the answers, or at least the conversation and open-mindedness to talk about it that they're looking for.
Yep.
And so they're saying, well, if I'm not going to get it from my specialist, I'll learn to do it myself. And it's not, nobody that I'm talking to that's doing early intervention with expansion and with Invisalign First or any of this really sought it out for their practice. They weren't like, I'm so interested in this. I can't wait to take these courses and learn about it. They're just saying, I know this is the right treatment plan because I've taken all of these courses to know it.
Yep.
I'm not getting it from my specialist, so I'll do it here. And I think that's going to continue to happen.
You're 110% correct. And I know that because that was actually my master's research. And 20 years ago, I think you can find the article out there on the internet still, but I actually did research on general practitioners and pediatric dentists performing orthodontic treatment in their offices. And by and large, it was happening, just starting to become sort of almost this movement that was happening back then. And the reason they cited across the board, the most common reason that I listed out in the questionnaire and had the data analytics for, was the orthodontists aren't doing it in a way that I feel is best for the patient, and they won't listen to my suggestions. And I heard all the time exactly what you just said, where they said, I had my own child. People would write, I would get like in the comment section of the survey, people just go through a lot of detail. It was really kind of interesting to read and hear about. And then I heard the same thing when I was in private practice from general practitioners. And they would say, I started doing this because I was sick of seeing every kid I sent with narrow arches and 7 years old to the orthodontist come back with teeth pulled. And I see that person 40 years later, as whether it's that particular patient or one that looked just like them, but I see that type of situation 30, 40 years later, and I see the breakdown. I see this TMD. I see the occlusal destruction. And I had, for my patients, I had to figure something out. And I can't blame them. Like I actually give them credit for that. They could have just put blinders on and said, I guess this is orthodontics. It is what it is. But they said, no, I'm going to go. And a lot of them said, I had exactly what you just said. I had no desire or intention to get involved in orthodontic treatment. Some of them said, I don't even really love doing it, but I sleep better at night knowing that I'm doing the right thing for my patients. And the last thing on that is a lot of them actually said it was once and it's just how we all are, once we see it in our own kids, a lot of them said, like, I hadn't really thought that much about it. And then once I saw my own kids were narrow or mouth breathing or whatever, and the orthodontist wasn't concerned with any of that, but just wanted to take teeth out and wait until they were older, I had to do something. And I heard that time and time again. So you're 100% right on that.
And I think the other thing that's happening, I feel like I'm a restorative dentist trained in orthodontics now. Like my brain still goes to the restorative aspect. I went through so many years of taking a lot of CE in that area. What I'm seeing happening is that the restorative dentists are really upset with the orthodontic community for not being open-minded to treatment plan, the way they're being taught at these conferences and in their own lives, seeing things happen. And then on the flip side of it, which there's merit to this, the orthodontists are really frustrated because they're seeing general dentists do orthodontics and it's not done to the standard of orthodontic treatment. A lot of times the intention is good. The motivation is airway a lot of times, or even just when somebody's doing aligners in their office. But because they don't have the orthodontic training, they're not treating as well as an orthodontist could in the same situation. And so I think we've got these patients that are stuck in the middle, being not treated as efficiently and effectively as they could be, because the ones that are trained to do it aren't, and the ones that are motivated to do the treatment aren't trained correctly. And we still keep orthodontics locked in this box and don't want to talk about how to do it. And I really believe if there were more training in orthodontics to general dentists, they would elevate their level of orthodontics they choose to keep in the practice. but I think they would overall refer more out if they had the right orthodontist to partner with, because they would recognize you don't know what you don't know until you're shown it. I went into residency thinking, I know exactly how to treatment plan a case. I'm spear trained. I know where the teeth belong. I just need the mechanics know how to get them there. And then I got to residency and I was like, oh, this is a whole different ball of wax. I was not looking in the transverse, in the AP direction, the same way. I knew vertically where I wanted the incisor and treatment planned like a denture off of that.
Right.
But you don't know the same way of approaching things. So I think there's a crossroads that's happening right now in the field. And we're going to choose to take orthodontics in one direction or the other. And I think the fate of orthodontics is going to be dependent upon how we choose to make these next few years decisions in how we treat.
I completely agree. I think that is so well said. And I hope that our leaders in the profession and those in academia, and as I've said on the show often, I kind of have a unique perspective because did this for almost 20 years clinically, building my own practice from nothing into a very busy, successful practice. But throughout my career, I've maintained an active role in academia, and even more so now. So I've seen it from the inside of multiple institutions, and I can see this disconnect between academia and clinical practice. And even getting into some of our organizations, right? And some of the influence they have, there's this disconnect. And until we start to come together as orthodontists, as a profession, and see the value and become open-minded as a group, not just little pockets of us, towards this paradigm shift towards going in younger, helping these kids proactively, becoming a more proactive etiology-based profession instead of a reactive mechanical profession. I think you're exactly right. We are going to face a day where it won't happen in an instant, but it's going to be this sort of general trend, and then there's going to be a threshold's going to get reached, and the obsolescence of the orthodontist is conceivable if we don't start to change with the times. And that doesn't mean, this is the other thing, and then kind of finish on this. I want to go into some other topics, but enjoying hearing your thoughts on this side. But the other thing is, I almost feel like when I talk to a lot of orthodontists, especially in academia, they're so resistant to the change because it's almost like they would have to admit that the way they did it all this time was wrong. And that's not it. I mean, nothing we do today is what it was in the medical and dental arena, what we did decades ago. It doesn't mean you're wrong. It doesn't mean you're liable. It doesn't mean that everyone you pulled 4 buys on that had a transverse deficiency in 1980 and now has sleep apnea is your fault. It means that you did the best you could with the tools you had, but it's time to grow and change and understand where we need to go instead of holding on. And I say, like, clutching those pearls to say, this is just the way we've always done it. I mean, there are administrators in residencies that don't want cone beam because it breaks the tradition of the tried and true tested cephalometric analysis. And I'm thinking, really, you're going to die on that hill? I mean, really, we're gonna have the argument that 2D is better than 3D? I think it just, old habits die hard, and I just wish everybody could just have a little more grace with one another and say, it doesn't mean you're bad. Doesn't mean you're a bad practitioner. Dan Grobe, who was on the show recently, he practiced for 30 years, basically, with more of a traditional approach to orthodontia. And when he paired up with a pediatric dentist in sort of the second phase of his career, he started seeing things very differently. And he was able to look back, and it's not easy to do. And I give him tremendous credit for saying, yeah, maybe the way I was doing it, I could do better. And now he's very proactive on early treatment and cone beam and airway. So, and he's like, I get it. There were cases that I wish I could have done differently, but at the time, that's the best I did. And it doesn't mean I was doing it poorly, but now I know better, and I should do better. So I don't know if you think that that's part of it, if it's pride, if it's ego, I don't know, but there's something there.
I don't know. People are like set in their ways, and I've seen the amount of heels that dig in hard. It makes it really uncomfortable for those that don't see that way to speak up. Because there's some loud voices in orthodontics saying, what is this mysterious posterior tongue tie? And the intraoral volume has nothing to do with, I mean, anecdotally, without any research, if your tongue doesn't fit in your mouth, it has 2 places to go. It can hang out the front or it can fall to the back. Yep. And I don't see many people sleeping with their tongue hanging out of their mouth like a dog. So that for me just says, like, we need to wake up. I get we want more research. I get we want to protect ourselves as a profession. I think we need to do that. But I also think we need to open our eyes and our ears to be level-headed, but open-minded.
Open-minded. And not, I almost feel like they're using that as a crutch to say, yeah, well, you can't really prove this. Well, the research needs to come from academia. So in other words, the average private practitioner isn't really equipped or able to be running these randomized control trials over long periods of time. And we could do some retrospective studies and look at our data, but even that, your average orthodontist is too busy and has too many other things going on, which is the next part we're going to get to,
Right.
in sort of all the challenges in life we have on top of this to be running these studies. So why can't academia at least pair? I'm actually working on some projects now with the residents at NSU to try to look at some of my data from my years of clinical practice and cone beam data and clinical data to try to shed some light on these issues. But and it's awesome that they're open to it there and they're willing to let us investigate this. But I feel like at a lot of institutions, they say there are no data, they say there's no literature, but they're certainly not willing to try to run the studies needed to do it.
That, and I think people stand behind, we do this all the time. You stand behind religion when it's convenient and you don't follow the traditions when it's not. Same thing with research. It's like, well, we're still using class 2 correctors that have skeletal change, but when you look at our research, it's telling us that the mandibular endpoint is the same with or without intervention, but we're still using our MARAs and we're still using our HERPs. So I think we find what works in our practice, and then we use whatever tool we need to, whether it's the research or otherwise, to say what I'm doing is right and here's why, and what I'm not doing is wrong, which is why I'm not doing it and here's why. But we have to be consistent with how we use our research, which we are not consistent at all, and when it's a usable tool and when it's not right now. So we need to reevaluate a little bit there.
I'm so glad you said that, because I really do feel that as well, that people will use research when it's to their advantage, but then there are plenty of articles and papers that prove everything you and I have talked about to this point. Plenty. I always reference going back to Engel in 07 and E.A. Bogue in 1913 and Holzman in 1928 that had comments on the tongue space and mouth breathing and airway and the impact on craniofacial growth and development of all of that well before cephalograms were even being taken. So we've known this for a long time, and there are tons of, you look at some of Ricketts' art data go Melvin Moss and Enlow in the 60s and their studies on form and function and the functional matrix, and then Ricketts in the 70s and talking about the airway. He was huge talking about, and people know of him for sort of his bioprogressive side of things, which is also important in his treatment objectives. But ultimately, he was starting to really put some data out there to say, hey, look, these patients can't breathe, and we need to be aware of tonsils and adenoids and mouth breathing and snoring. So it's been there, which is why your point is so great. I think we just pick and choose what we want to listen to, and it's really easy to be like, oh, I don't know, nothing convinces me. It's like, what would, right? like what would a randomized controlled trial where you don't treat one child the way you know you could help them and let them suffer? Like, is that because that's unethical and we can't do that. Bill Harrell, who's on my show, was talking about that as well. He had a great point. He's like, to design that study, the ethics, you can't breach your ethics that way. You can't leave someone who's suffering and say, we're not going to send you for a tonsil adenoidectomy. Like, we can't do that. So, anyway, so there's some challenges there that are bigger things that we can solve in this show. But I love that you brought that up and made those points, because they're awesome points. And I think it gives everybody some food for thought out there on that. So kind of taking to the next step, which I kind of teased in the beginning here, but you have a lot you deal with. And I think that is something, I know that is something that when I speak to colleagues, when I was practicing, now coaching and talking to them, that's something we struggle with, a lot of us, especially in the middle ages, as we're into our practice lives. We have families now, we're very busy, a lot of commitments. And as a mom, I think it's even harder. And I think you're dealing with another level. You have to be the one that's pregnant for that period of time and dealing with those challenges, which I don't know how you all do and continue to work and push through the way you do when you're having to deal with that and growing a baby at the same time. But even after that, right? Now you have 2 kids and husband and house and a practice, and that's a lot. So how do you do it? What are some of the things that have helped you? And what advice can you give to men and women, but I think especially moms who are struggling with that in our profession, or really in any profession or career? Have you heard about the Doc community on Facebook? It's where you can get access to more great content, including case reviews, select clips from CE courses and podcasts, literature reviews, and exclusive promotions and discounts off Doc educational materials. Just go to Facebook and search for the Doc community and submit a request to join the group. And now back to the podcast.
Yeah, I wish I had figured it out. I'm still struggling with the juggle, and I think it's just the juggle is the norm for me. I'm very fortunate to be part of a really impactful women's mastermind group. Rebecca Bacall is part of it. There are 16 women that are all different ages. We lecture, we have private practices we own, and that is a safe space for me to be able to say, how do I do this? And as an example, we hired somebody that helps us pack my daughter's lunches for daycare because I'm really particular on what food she eats and quality of food. And they help us with laundry. And I grew up in a house that was very blue collar where that wasn't an option. And it takes other people telling me you can't do it all. And you have the choice of spending time with your daughter or doing laundry. You have to make those kind of choices of how you're going to spend your time. So the mastermind group has been really impactful for me. But looking back, I think those of us that gravitate towards dentistry in general, and especially when you specialize, and we're high achievers and we have really high standards for ourselves, really strong goals within our career. And I think I waited to have kids because there wasn't room in my life for kids for a long time. So I didn't stop to ask myself what I wanted. I just reactively said, the life I have crafted for myself has no space for anything other than my dentistry, my practice, my lecturing, my continuing education.
Interesting.
And I'm way more tired pregnant at 40 than I probably would have been pregnant at 30. And so I waited longer to prioritize my family than I likely should have. And so I'm really trying to, work-life balance is just non-existent. There are some weeks where you just have to let one go and because the other's taking over. But I am in a position now where I recognize if I don't take care of myself and what my needs are, I can't be taking care of others. And that goes for both your professional and your home life. Like if I'm not taking care of myself, I can't take care of my daughter as well. I can't be as good of a wife. If I'm not taking care of myself, I can't take care of my patients or my team as well. And I still struggle with that all the time. I'm still working on it. I would say like you blink and time goes by. And so I think you need to take a step back, especially when you're a high achiever type A person, to say, what do I want my life to look like in 5 years? And what do I want it to look like in 10 years? Because if you don't ask yourself, those 10 years fly by and you don't have a life that you would have chose for yourself. And that's where I was with my restorative practice. So I'm trying to be more intentional this time around than I was the first time.
Yeah, that's really well said. I appreciate you opening up and being open to discussing that, because I think it's so easy to do exactly what you just said. I did it. And I completely agree. It's those type A overachievers, which so many in the dental profession, or almost any business owner. I mean, most people who own a business have that overachieving personality, because otherwise, it's going to be more work. You're going to put in more hours and more time in any business, no matter what you're doing, especially when it becomes into the professions. And I started noticing this when I was teaching. I was overseeing and running the orthodontic component of a general practice residency in upstate New York, near where my practice was. And I would teach them lectures on sort of the basics. It was a 1-year GPR. Well, intent wasn't to teach them how to do ortho. It was to just kind of expose them to the orthodontic side of things and help them understand when to basically refer patients and what to look for, and when things were happening orthodontically, what it meant. And I realized after a few years of doing it this way, and this is going back almost 20 years ago when I started doing this, they weren't really excited about it. It just was, they'd come to the lectures and we'd have clinic, and it just wasn't anything they were super excited about. So I decided to start to pick their brains on what they wanted to learn about. And a lot of it was the business side. And a lot of it was sort of how to manage their time better. And as it went on into the time when then smartphones came out and everyone's life got so much busier, and digital technology grew so much, and practices got so more complicated, and debt got so much more intense from educational debt, a lot of it evolved into goal setting and vision, developing a vision for yourself. Because I saw so many of these young docs, and they're done with dental school, they're in their residency, especially the female doctors, and they're like, I've put exactly what you said. I've put everything else on hold. And I almost feel like now I don't know do I try to catch up? Where do I go from here? My career goals have superseded everything. And I think that's easier for a guy to get away with than a female. I just think maybe it's just traditionally the way society is, that it's like, okay, the men kind of become the breadwinner, but I think a lot of it is because the women are the ones who have the children, and you can't change that. You have to deal with the fact that you have to be pregnant for a period of time, and then you have the child. You're the one that has to breastfeed the child and nurse the child. I mean, there's a responsibility there that the guy just doesn't have. So we can start a family life, and my biggest challenge was trying to make sure I was present for my family, and not be at the office all the time, and working insane hours, which was something I was guilty of, and had to do make some major changes to change that. But it's different than if the mom's doing that. And I saw it time and time again, and I see it to today, with younger docs. So I'm so glad you brought that up, because I don't think young professionals, but even in like college, I just don't think they start taking the time to think what they want their life to look like in 5, 10, and 20 years. And as you said, it happens. All of a sudden, it's 10 years later, and you're like, okay, now I'm here. I achieved my professional goals, but now what? Do you agree with that?
100%. I always, as soon as I achieved one thing, it was, well, what's next on the list?
Yeah,
and I
right.
hit a point in my practice where I had checked off all of the major boxes professionally, and I was really unfulfilled. And so
this is in your restorative practice.
In my restorative practice, yeah. My practice was beautiful. I had the dream practice. My team was amazing. They could run it without me. Like all my team they were team players, all on the same page, got along really well. I did not have to advertise to get patients. I had the amount of patients that I wanted in my schedule. It was a profitable practice. It was a huge goal for me to get accredited through the Academy of Cosmetic Dentistry. It was a really arduous process to achieve that. I achieved it. And then you just kind of sit back and you're like, okay, I've been fixing things for so long. I've run out of things to fix, and I'm not going home fulfilled. I'm burning the candle at both ends, and it's not only not fulfilling, but it's unfulfilling.
Yeah.
And that was where I knew I needed to take a step back and say, okay, if I keep doing this, who am I going to be 10 years from now, 20 years from now? Like, what am I going to look back on and feel good about?
And this was like your mid-30s you were feeling?
Yeah, probably like mid-30s when I was going through this. I graduated dental school at 26, and had just been hustling since I graduated. And it was probably like mid-30s when I was like, okay, something has to shift here. And I hadn't even stopped to ask myself if I wanted kids. I just knew, like,
interesting. So at that point, it wasn't even on your radar necessarily. Interesting.
No, and if I had asked myself, I may have said yes at that time, but I didn't ask myself because I knew I was functioning. I was barely keeping afloat day to day by leaving. I had 12-hour days from the time I left my office till when I came home, and then I was opening my computer to run the practice once I was home.
And I know that day.
I used to get on I'd finish clinic on a Thursday night at 5. I'd rush to Boston Airport. I'd fly into Scottsdale, Arizona, Phoenix, drive to Scottsdale. I would teach Friday, Saturday, Sunday, take a red eye home Sunday night, and drive to the office from the airport Monday morning.
Wow.
And it was just a really unsustainable lifestyle that I finally was like, what am I doing this for? Like, what? Yeah. It's not money. It's not like ego. It's not, I just couldn't answer the question anymore. And I was like, it's habit. I'm doing this because it's habit.
It's the curse of a high achiever.
Yeah. Yeah, for sure. So I try to be a lot more intentional about what I say yes to. It either has to bring me great joy if I'm going to do it now, or it has to make me money that allows my family to have more joy. And if it doesn't fit those categories, I try to be better. I'm not perfect at it by any means, but I try to be better about saying no. And I am a lot better today than I ever was at saying no.
How would you help your younger self to obtain that wisdom earlier than you did, if there's any way you could? Or in other words, how would you help other young professionals, especially females, who are where you were, say, 15 years ago, to start to obtain the skill set you now have, that you had to come about through experience and kind of the hard knock side? Is there any way you could have them figure it out proactively, you think?
I think when you start to feel the burnout creep in, and you start to feel overwhelmed, and when your conversations at like family events or parties are like, you start to almost feel like, well, you don't know what busy is. Like, you should feel like, woe is me, because you're just so run down. Like when you start to have those feelings creep in, I think that's the point at which you need to listen to yourself and make an active decision to change. Because if you don't, it's just tomorrow's going to be more of what yesterday was. And I did 10 long years of just having my schedule. Like, I didn't know what a day off was, because if I had one, I was like, what 10 things can I fit into this day, because I don't have these other obligations. Whereas now I try to say, let's take a step back. How am I going to make this week better than last week was, and have a little bit more time for myself? So I think if you can, we all feel it. It's whether or not we listen to it and make a change, or whether or not we complain about it and keep going with the same habits, that determines if we're going to be in a better spot in a few years.
Yeah, I agree. I don't know the answers, and I've struggled with that as a teacher, because I do have young docs that ask me these questions a lot, and I don't have the answer, because I mean, when you were describing your day, I'm like, yep, there's my day. I didn't do as much traveling on top of it, as I had kids pretty soon after I finished my residency, but it was, yeah. I mean, I think a lot of people out there listening to this hear you and can literally put themselves in your shoes or my shoes. And my mistake was I was a super planner. I had everything planned. I knew what I wanted. I knew how I wanted to start my practice, run my practice. I knew the vision of the practice I wanted to build, and I was able to succeed at all of that. My problem was I didn't have a plan for what happened when my practice got super, super busy and was more than I could alone handle. And I then had to try to catch up at that and kind of do that on the fly, which, like you said, when you're that busy and there's no margin. And I think that's
survival mode. You're not thriving. You're just surviving at that point.
Yeah. Yeah. You're that's exactly. And you don't have the margin to then step back and judge. And really, COVID for me, that shut down. And I've talked to so many people in the professions and just in general in life that really had a reset of their mentality when we could actually breathe for a second. It really weird. Obviously, it was an awful experience for all of us, but it also forced us to stop what we were doing for the first time. And for me, my life, I guess, right? I never really couldn't go do what I had worked hard to do. I had to stop and think, and I slept a little more than I had in a long time, which was something that I tell people, please, I tell my kids, please don't do it the way I did it. I'm much better on my sleep hygiene now, and it's something I've grown a lot in. And credit to my wife, she was telling me for a long time, and my parents, that I needed to do better in that arena. People saw it. Yeah, I think that's another thing. People listen to the people around you, and people saw that before I did. I was like, I'm fine. Everything's great.
Almost like you get proud of I can function on 4 hours of sleep.
Yes.
I can do it. And why? What are you doing it for?
Right. My staff used to joke that I was a vampire. They're like, I don't think he's, right. There's a certain weird, I don't know if it's a narcissistic pride. It's but now I look back, I'm like, what an idiot. I mean, that's not a way to live your life. And thankfully I was able to make the changes to put myself in a different position. But I think a lot of people don't. And then when you're not sleeping, when you're not, and I was still very fit and healthy and worked out. And so I didn't look the part of somebody who was struggling in that way. And I think most of us don't, right? We're type A achiever. We're particular about all those things. Got to check all those boxes in a day. And I think if someone had said it to me back to help me, it would have been, you need to you developed your plan from your professional side and even personal family side, familial side, but you have to keep working on developing that plan at 5, 10, 20 years out. You can't just do it once, get there and think you've gotten there. And that was my mistake. I didn't revisit, and I've always revisited my financial plans and all that, but my personal plan, what my life was going to look like in terms of free time, scheduling free time. I mean, it was years before my wife finally convinced me we could take a vacation from the practice. I mean, why? I don't know. I just felt like I need to do this. And again, it wasn't like that extra money of a week here or there. It was in any way. I mean, the first couple of years you start your practice and you're building everything, but for a couple of years, what's an extra week? But I think, like you said, it becomes almost this pride of, I don't need that.
Yeah. Yeah. And I think we're fear-based too. For me, I know I still struggle with it. It's all right, I want to get home an hour earlier, so I have an hour extra with my daughter. But all of my patients want post 4:30 p.m. appointments because of their kids' school and sports schedule. So I have to work this because it's what the patients want. And you get fearful. And all of a sudden, I'm taking 3 weeks leave for maternity leave, and my schedule right before I leave and right after, patients will take whatever you give them if they can see me before I'm out. And I'm all of a sudden, They don't need 4:30. 10:30 a.m. works just fine if I'll get them in. So
Funny how that works, right? Yeah.
We make these decisions out of fear of, the worst case scenario and don't realize like if we make decisions that are better for us, like it's going to be okay.
Yeah. And setting those boundaries. I think, it's boundaries are hard to set and they're not comfortable, but I find every time I do it, I'm so much better off from not just a personal perspective, but from the relationship perspective, and whether that's with a patient or a loved one or a friend or acquaintance or whatever it is, but setting those boundaries. And I feel like the more I kept achieving and pushing, the more I just didn't even have time to think about setting boundaries. I was like, I'm just going to do it. And then you take more and more on and you get caught up in this vicious cycle really of just doing. And again, I give you a lot of credit for continuing to work on that and being open to talking about it, because I don't think when I was in the middle of it in the spot I was, I don't think I could have realized it. And I think that's the problem with a lot of people is it's like when you're doing it, you don't even really know. And
yeah.
I don't know how you help somebody to know.
That's absolutely true.
Yeah. So, where are you at now with the practice? We'll just kind of close up. I'd love to hear kind of what ortho life is like now. You got a new practice. You got second one on the way here. You're kind of over that transition through going through your ortho residency and now in the practice world. So what is life like now, and what are you looking for to do in the future going forward?
Yeah, like I said, I'm trying to be better, but I'm still not there. In the last year, I renovated a practice, changed the software in the practice, bought a new house, renovated a house. Like I always keep a lot on my plate, but my intentions with where the practice is going right now are to balance work and personal life a little bit better. So in the process of planning a second location in anticipation of bringing on an associate eventual partner in a year, bringing her on, I think will allow me to take a vacation and know somebody else cares as much as I do when I'm away. It's hard to find that person, but I feel like I have that person.
Oh, great.
And really trying to be intentional about when my husband and I sat down to map out our 5-year plan, it's how much time do we want to spend in the places that make us happiest? How much time out of the office? And
love that.
We're not doing it today, but all of the things we're working really hard at that are keeping us busy right now are in anticipation of 5 years from now, having more freedom, geographic freedom and time freedom than we do currently. And we're trying to be more intentional about that than we have been in the past.
I love how you said that it's not going to happen today or even tomorrow, but it's a plan. And that I think is so important for people to realize. Again, not to overstate the high achiever thing, but as high achiever, we want it now. We want to do it and see a result. Like if I'm doing this, I want to see the fruits of my labor now.
Yeah.
And I think people could learn a lot to just say, wait a minute, this is a plan and a process. And I get it's not now where it needs to be. And that's actually okay as long as I'm working toward the goal. But without the goal, if you had said what you just said and you didn't have a 5-year goal, well, then what is it, right? You almost feel like a failure at that point because you're not working towards something. Now you feel like if you're being more intentional with your time, well, as you said before, you're dropping one of the balls that you're juggling because but if it's part of your vision and your goal, it's like, no, this is it's almost like tricking our wiring of our OCD brains, right? To say like, wait a minute, no, I'm doing this for a purpose, so it's okay. Giving ourselves sort of the grace to say like, this is okay to do because it's part of my goal.
If I didn't have the personal plan, I think it would be too easy to say, now the second location's open. Now I have to do X, Y, and Z to keep them both successful. The money starts to come in when it hasn't in the past. And you're like, okay, I can't afford an associate and you talk yourself out of making changes that make life easier. So I'm really trying to stay on the path of like, these decisions are for this goal. I'm not going to let the decisions forget to have a goal and just like determine what my fate is. So I don't know. We'll talk again in a couple of years. I'll let you know how well of a job I've done with that.
Absolutely. I will take you up on that and definitely want to stay in touch with you and wish you well and all you're doing. It's amazing what you've accomplished, your journey, and we just kind of scratched the surface of it today, but it's unique. It's unique in ways of how you've persevered through a lot of different things and gone different avenues. Not everybody goes through 10 years of restorative dentistry, builds that practice and goes back to ortho residency. I know some do, but it's not common. But I think your journey is common in the sense that we all struggle with a lot of the things you've struggled with. And I can't tell you how much I appreciate you being willing to open up about that, because people are able to hear this and it resonates with them and they can share it with others. And that's one of the things I love most about the podcast arena is, someone hears this and like, they can just kind of on their own think that maybe that's me and maybe there's some things I can do. And you've offered a lot of pearls in that, and still goal setting in, as you're in this sort of mid phase of life, and not just saying, well, now I've got here. Cause it would be so easy. It's funny you said that, cause I'm thinking it's so tempting and easy with people with our personality to now start this other practice and repeat all the same mistakes. It's so easy. It's almost hard not to. And I give
daily struggle for sure.
Yeah. Yeah. And I give you so much credit for recognizing those mistakes you made and being willing to adjust and make the adjustments. And obviously it won't be perfect. It's not going to all work out perfectly every day, like you said, but on a bigger picture vision, and you'll get it, you'll do it. I mean, it'll happen. So, yeah, it's really sage advice and something that I know that's going to help a lot of people out there listening, that you were so open and sharing all that you went through and are going through.
I hope so. Well, thanks for having me. I really appreciate it.
Yeah, no, my pleasure. Best of luck with the little one and the completion of the pregnancy here. And it's going to be exciting. I'm excited for you. Do you have an anticipated delivery date that
Nope, he's going to decide when he's ready, and we're going to go from there. So.
Okay. All right, good. Well,
you can plan as much as you think you can, and then I think he'll take over from there. So we'll see.
But so it's a he. So you're going to have a boy and a girl. Oh, that's cute. Yeah. Neat. Very cool. Well, congratulations. Wish you all the best. Stay in touch. And again, thanks so much for coming on and being so open and sharing.
Will do. Thanks again. Have a great one.
All right. You too.
Bye.
Bye. Thank you for watching this episode of the Doc Podcast. Be sure to visit theorthocoach.com to get access to ADA CERP recognized CE courses or to schedule a private one-on-one coaching session with me. And remember to join the Doc community on Facebook for more great content designed to help you succeed both personally and professionally. Just go to Facebook, search for the Doc community, and request admission into the group. You can also find Doc on Instagram at @theorthocoach. And always remember, you have been blessed with the ability to do amazing things.